The face is the first thing that people see when they interact with you. It's important that we're able to animate, move the face, close the eyes, get a smile. It's extremely rare that we can't offer anything to the patient. There is always hope and there's always treatments. We have our team of experts that are extremely passionate about dealing with patients with facial paralysis, and our goal is to help patients who have lost that function get that function back. Whether it's from a tumor or from Bell's palsy or for congenital reasons, each patient has their own specific needs and demands, and we look at that and try to understand it.
The first time that I remember that there was any facial asymmetry was when I was on vacation with my father, and he asked me why I was smiling like that. And I said, "What do you mean?" And he said, "Well, you're smiling crooked." Over time, the facial asymmetry did bother me. When I would have interactions with people, they would sort of look down to my mouth, and I knew that they were noticing something. No one could figure out what to do in other health systems. And that was the complete opposite when I went to see Dr. Mardini. The competence and confidence that Dr. Mardini invoked, that he could change my life, he made it clear that that's what his mission was from the beginning.
There is a huge focus on the patient being in the center of our treatment. We formed a group of experts in the field of facial paralysis and reanimation, and that's plastic surgery, neurology, oculoplastics, ophthalmology, and physical medicine and rehab. Our goal with every patient isn't just to restore function, it's to restore aesthetics as well.
Throughout the facial reanimation journey, emotionally, it was pretty intense, but Dr. Mardini and his team mentioned to me that it was going to be a positive outcome. They had to extract the sural nerve in my left leg and attach it to the right side of my face. That had to regenerate, and then there was a surgery to do some fat grafting to correct some of the asymmetry. Given my experience with the facial reanimation surgery, I can't imagine doing anything differently. It does change my confidence level. It does change my self-esteem. It makes me want to smile more.
There's no better place in the world where you can get incredible patients, incredible physicians and staff and allied health working together just for the benefit of the patient.